The biggest asset of a country is its people, and these people can contribute to the success of the nation only if they are healthy. Thus, the most important thing for a country is to look after the health of its people. What is health? Health generally means having a fit body free from physical disease or illness. It is a state of physical, mental, and social well-being. Various factors which affect our health are balanced diet, clean drinking water, unadulterated food, clean and hygienic living conditions, pollution-free environment, and absence of mental strain or anxiety. According to our Constitution, it is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. The government must safeguard the right to life of every person. Health care in India. 1. India has substantial health care resources and manpower. 2. India is the fourth largest producer of medicines in the world. 3. India is one of the biggest medical tourist centers in the world. 4. Approximately 20,000 public and private hospitals are available in India. Some of them are specialty hospitals. 5. Medical education in India is one of the best in the world. India boasts of 381 recognized medical colleges. Negative factors in the field of healthcare in India. 1. Indian doctors want to settle in urban cities rather than serving in rural areas. 2. Rural-urban imbalance, shortage of hospitals, non-availability of healthcare staff like doctors and nurses, and facilities like laboratories, ambulance services in rural areas. 3. Waterborne diseases like diarrhea, worms, and hepatitis, etc. are so rampant because potable drinking water is not available in many villages. 4. Millions of people are suffering from tuberculosis and malaria in rural areas. 5. Infant and women mortality rates are still very high in rural areas. Role of state government in providing health care. According to the Constitution of India, health is a state subject. It makes every state responsible for ensuring good healthcare facilities to all the people in the state and to raise their level of nutrition and standards of living. A. Public health services. The public health service includes healthcare centers and hospitals run by the government in both rural and urban areas. They provide treatment to all kinds of health problems, from common illnesses to special services. Public healthcare services have a three-tier structure. 1. Primary, at the village level. The health centers in the villages are usually managed by a nurse and a village health worker. They are trained in dealing with common illnesses and work under the supervision of doctors at the primary health center. PHC, which covers many villages in rural area. Primary health centers also focus on issues like infant immunization, anti-epidemic programs, birth control, medical care for pregnancy, and childbirth in rural India and emergencies. 2. Secondary. At the district level. The districts have a district hospital. It also supervises the rural health centers. 3. Tertiary. In urban areas. Towns and cities have many government hospitals. These hospitals are well equipped and have advanced diagnostic support services, specialized intensive care units, and specialized medical personnel. These hospitals are established by the government. They are funded from taxes collected from people. Provide quality healthcare services either free or at low cost. Take necessary actions to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. B. Private health facilities. Private healthcare. The private health sector is a major healthcare provider in both urban and rural India. According to National Family Health Survey, the private medical sector remains the primary source of healthcare for 70% of households in urban areas and 63% of households in rural areas. India has a wide range of private health facilities in the rural areas. Rural areas have registered medical practitioners, RMPs, who have their own small clinics. Private health facilities in urban areas. Urban areas have a large number of doctors running their private clinics. There are many private-owned hospitals, nursing homes, and chemist shops. Urban areas have many sophisticated, well-equipped laboratories which provide facilities for tests, X-ray, ultrasound, etc. Some private hospitals are super specialty hospitals and are equipped with the latest state-of-art equipment and facilities. Disadvantages of private health services. Unlike public or government hospitals, they are not free. They are run mainly for profit. They are extremely expensive and are unaffordable by majority of people. In order to earn more, some private service providers may encourage practices that are incorrect, such as prescribing unnecessary medicines, stay in the hospitals, etc. Disadvantages of public health services. Long queues in public hospitals. Poor quality of care in public hospitals. Distant locations. Inequality in healthcare services. There is a big rural-urban divide in healthcare. People in rural areas have to travel long distances to reach primary health centers. The primary health centers are ill-equipped to take care of any serious ailments. They do not have enough doctors, medical staff, or medicines because of shortage of funds. They lack facilities like ambulances, blood banks, or pathological labs. Rural areas lack proper sanitation and clean drinking water. These conditions are excellent breeding grounds for diseases. In fact, they are the people who need medical attention the most. Urban areas have good facilities, but the medical costs are prohibitive. Poor people cannot afford to go to private hospitals. What should the government do? It is important that the government should allocate sufficient funds from their budgets to look after the rural areas where 65% of the Indian population lives and provide for an affordable healthcare system to both rural people and urban poor too.